We had a few technical hiccups along the way with that one, but we got there in the end. And I think what really impressed us as a board was, so when we were looking at all the abstracts that were submitted for the conference, and we added at a far later date this a section on the COVID and the oncology nursing response to the pandemic, because obviously when we were originally planning the conference, we're planning the conference from the day the last one finishes. So we're always looking ahead. So when we started planning the conference, obviously COVID hadn't happened, and we really wanted to make sure we captured that and the impact it had on our nursing teams and our patients, because so much the impact for cancer patients was massive of the pandemic. So many of our patients were the vulnerable, the shielding patient groups, and how our nurses responded to that and tried to innovate to really make sure that those patients weren't lost and were supported as best we could at such a difficult time. We really wanted to capture, and we were so impressed with the things that people have put in place. People really stepped up to it, and they really did their damnedest to make sure that they carried on supporting patients. And we were so impressed with the initiatives that took place. So it was actually really hard to pick the ones for the oral presentations, but certainly the ones that we went with, I mean, the telephone triage for patients who wanted to ring it, who were concerned that they might have a cancer, so innovative, so well thought through, and really working with the commissioners and their GP colleagues and primary care, all of that just showed that ability to adapt across the service. And then supporting patients, so the work done at Guy's and St Thomas's around managing patients to manage their own central lines, their PIC lines. And again, there were several examples of that, and what they produced at that, really, that presentation on how they supported patients to do that. Again, really, really key. The work around the virtual platform for supporting patients with myeloma, and that went on to, of course, win the category for the Best Young Cancer Nurse Award. So, that again, it's that thinking around how do we support patients differently given the circumstances, and then that really important piece of research that really adapted to the pandemic and looked at the patient and carer experience. And I think for me, what came through on that with the carer experience was really important as well, because obviously we were all focusing on patients and the need to support them and by default carers, but actually those carers have really, the impact on them has been significant. So I think it's really good that this project was trying to capture that experience and work with carers to understand how they have been coping through the pandemic. And of course, we're not through it yet. So all of these things are carrying on being so important. But also what was great with the innovations to support patients, most of them want to continue with those. They want to keep those when we come through the other side of this, because a lot of this can be adapted to life outside of the pandemic. And I think it's really important that the things that we have learned during the pandemic, we carry on using as much as where it's realistic and appropriate, that we do continue to use a lot of these innovations moving forward.